Acute Otitis Media stands for Rapid Onset Middle Ear Inflammation. It is a very common condition, especially in young children. Most children have had 3 or more episodes by the age of 3 years old. Typically, an upper respiratory tract infection develops first, then acute otitis media develops. Upper respiratory tract infections are normally viral in nature. However, most cases of acute otitis media are actually caused by bacteria, the most common being Streptococcus pneumoniae. Let's take a look at the ear canal. Viral upper respiratory tract infections are thought to disrupt the normal microbiome within the nasopharyngeal region. This then allows bacteria to invade the middle ear through the eustachian tube. Acute otitis media will often present with ear pain, and in half the cases there will also be a fever. Discharge from the ear may also be present, and this would suggest perforation of the tympanic membrane. Otoscopy should be performed to visualize the ear canal and the tympanic membrane. Acute otitis media would cause bulging of the tympanic membrane and accompanying erythema. Perforation of the tympanic membrane may also be present, and this is often accompanied with purulent discharge. The ear pain from acute otitis media is due to rising pressure within the middle ear. Perforation of the tympanic membrane reduces this pressure as it allows the discharge to drain out. Quite often, when a perforation has occurred, the child will tell you that the pain has subsided significantly. Acute otitis media is generally self-limiting, and supportive management is advised. This means to ensure the patient is well hydrated and has sufficient analgesia and antipyretics available. Parents should be advised to seek medical help if symptoms either worsen or do not improve after 3 days of initial onset. Occasionally, antibiotics are prescribed, but they should be limited to certain situations, such as if symptoms have lasted longer than 4 days with no improvement, if the patient is systemically unwell but not severe enough to require hospital admission, if the patient is immunocompromised or at risk of other secondary complications, if the patient is younger than 2 years old with bilateral otitis media, or if there is any evidence of perforation of the tympanic membrane. The first-line antibiotic is amoxicillin, and typically a 5 to 7 day course is sufficient. For those with penicillin allergies, then either erythromycin or clarithromycin are used instead. Serious complications from acute otitis media are rare, but they're important to be aware of. There is the risk of mastoiditis, which generally will present with a painful, swollen, boggy feeling over the mastoid bone, meningitis, or a brain abscess. Anki flashcards are available for you to download in the description box below. If you found this video helpful, please consider liking and subscribing so that you can stay in the loop for more videos.